Good afternoon, and thank you for joining us for the live Riley County Coronavirus Response Update. Today is Friday, May 8th. My name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan. And joining us, as always, the woman in charge, the Local Health Officer, Julie Gibbs. And we have ASL interpretation provided by Tony Kroll of iSign Interpreting. Thanks for helping us out every day, Tony. We appreciate it. Julie, we'll start with your regular update about the numbers.
Sure, thanks, Vivian. Hi, everyone. As of today, May 8th, Kansas has a total of 6,501 positives. That represents an increase of 357 cases statewide since yesterday. There have been 608 hospitalizations and 152 deaths in Kansas. Riley County now has 57 confirmed positives. The newest positive, a 55-year-old female, is a spouse of a previous case this week. 36 of those 57 have recovered, leaving us with a total of 21 active cases, which we are still monitoring. We also have 47 pending tests, and there have been 608 negative tests in the county so far. We are still encouraging those of you with symptoms to call our screening line at 785-323-6400. This is available today until 10 p.m., tomorrow from 8 a.m. until 5 p.m., and will not be operating on Sunday. Starting next week, the screening line will only be available Monday through Friday, 8 a.m. until 8 p.m. Again, that number is 785-323-6400. We are also still encouraging anyone with questions to please email us at rileycountycovid19@gmail.com. If you are a business owner with questions about opening your doors, please email info@manhattan.org, or you can call the chamber hotline at 785-776-8829. Please have patience as we may be receiving a high volume of calls at this time. Again, that number is 785-776-8829. I typically start each of my updates with numbers, and while those are certainly significant, we all know this pandemic reaches far beyond those numbers of cases. We recognize the impact this pandemic has on businesses, schools, daycares, parents who are trying to make ends meet and provide for their kids, and last but certainly not least, all caregivers as we try to help our children with their homework. We should not take this lightly, nor have we. I think this community certainly understands the impact and has done a great job at making sure we still have safeguards in place. While we can start to move about a little more freely, I think everyone understands that we still need to maintain our distance, wear a mask when you cannot maintain that distance, and avoid any unnecessary travel. Thanks for being such a great community and for staying strong through this painful process. We will get through this and we will come out an even better, stronger community. Thank you.
Thank you so much, Julie. I really appreciate that. And happy Mother's Day to you. I know you've been taking care of your son and wearing a lot of hats during this process, putting in a lot of hours. So thank you so much. And I hope you have a happy Mother's Day this weekend.
Thank you.
Yeah. You talked a little bit, actually, we do have a question from the media today. Haley with the Mercury.
Thank you, Vivian. Yeah, this is Haley with the Manhattan Mercury. Julie, I was just wondering, where do things stand compared to what was projected for this time period? Kind of what is the status right now with what was projected and what actually has occurred? Thank you.
Sure, great question, Haley. As far as peaking, we are typically about 10 days behind the state. Just to kind of let you know that bit of information. But as far as number of cases that we were projected to have, we have been under that. I can't tell you off the top of my head about how much we've been under that, but we have typically stayed under that number. And that is a good thing. And we can relate that back to social distancing. I think we've done a great job as a community being, helping with the social distancing. And when we had the stay-at-home order, we did abide by that. So that shows in our numbers.
Thank you.
Julie, so this is kind of the end of the first week of the phased reopening in Kansas and, of course, Riley County. Can you talk, what have we learned so far?
Yeah, really, I think we've learned a lot from this. It's been a pretty smooth process from what we're hearing so far. I know that a lot of businesses that have chosen to open, they've done so very in a safe, controlled manner. They've taken a lot of those requirements and put them right in, and even have gone above and beyond. We've heard about some businesses doing even more than what was asked of them. So that's great. Hats off to them. They really care about their customers and their employees as well. So I think overall, it's been a very smooth process.
Thank you for that. Let's see, I'm trying to keep an eye on the Facebook questions as well. So if I happen to miss your question as it goes by, I'll go back after the broadcast and type in an answer. So, but still, please continue to send your questions. I've got several about kind of reopening and how the process has been going. Can you talk about what numbers are you keeping an eye on to help determine when it's safe to go to the next phase?
Yeah, so as always, we'll look at our percent of positives, but more importantly, we're looking at any clusters that we might see, whether it be in a business or in a long-term care facility. We definitely want to monitor that. We've not seen any right now so far. So we're doing good there, but we will also look at the capabilities of our hospital. Currently, we only have a couple of individuals in the hospital at this time, and so that's good. Luckily, we have had a pretty young population, and we typically have a young population anyway, but we've had a pretty young population as far as those with being positive with COVID. And so that tends to help in a way because they're not being hospitalized. We've had a small amount of individuals that have needed hospitalized. And so that really does help things out in our community. So those are some of the numbers we'll look at. Percent positives, we'll look at the severity of those positives, and of course, any clusters that are forming.
I know that testing capacity has been kind of a big data point that's remained an unknown in some ways because there have been some pretty strict requirements about when someone is eligible for testing. Do we anticipate that opening up even further or potential to test even more people so we have a better picture?
Yes, I know things are looking very positive as far as being able to relax that criteria according to KDHE. It has relaxed quite a bit since the beginning of all of this, and so we're fortunate for that, but I think we'll see that relax even more as we go.
Awesome. For phase one in Riley County, our order was slightly more restrictive than Governor Kelly's order. What's the plan for phase two?
So we're currently talking about that with the command staff, also taking input from our clinical task force and recovery task force. And then of course, just looking at the data that's available to us. We want to make sure that whatever the governor does, of course, that we're following along with that. We were a little bit more restrictive in phase one. This time around, we may end up relaxing that a little bit for this next phase because the numbers are looking good. We won't know for sure until next week. We'll see the effect of this opening starting next week. So if we continue to see not a huge spike, and of course we'll look at our hospitalized patients as well, then we may go a little bit more relaxed. And that may mean getting rid of that 50% occupancy limit on the restaurants, possibly removing that 10 o'clock p.m. time. It may even mean that we don't need to issue an order that is stricter than the governor's, maybe just going along with the governor's order. So there's a lot of different ways we can go, and that will all depend on our situation next week.
And next week's gonna tell us a lot with both from kind of the incubation period of the virus, which can you talk about what that is again? I know we covered it yesterday, but that's such an important piece. If you would talk about that again.
Sure. So generally the incubation time is 2 to 14 days. And that is why you'll see these phases 14 days from each other. That is a minimum. That's when we will start to see those effects. And that's why we say give it about 2 weeks. It might mean that at the end of next week, we might see a big spike. And that may mean that we have to stay in this phase a little bit longer. The governor may even decide that she wants to extend this phase that we're currently in at least a week longer. And of course, we'll go along with that.
the other piece of that timeline is the turnaround for testing. What are we seeing typically to get results?
Yeah, typically 36 to 72 hours is what we're telling patients at this time. That's what we're seeing at this time, especially through our swabbing station. It's usually 2 to 3 days is what we're seeing as far as turnaround time, which is a lot better than where it was in the beginning. Some people waited as much as 10 days for their results to get back. So 2 days is what typically we see now, which is a lot better than where it was. So we're grateful for that.
We've had good results in Riley County with social distancing. We typically see people out there doing the right thing. When we get complaints specifically about businesses who, folks are worried that the wrong practices are happening, who enforces that? Who checks on that?
Yeah, so first we want to know as much information as we can about this. We do get some general complaints that will come through, and we will follow up with that individual and ask them some more detailed information so that we have the correct information before we do have to send somebody out. We actually forward all of those on to our CPD, and they usually send someone, usually a supervisor, to go just ask about the situation. We never want to act in a harsh way. We never want to be, our CP doesn't want to be the bad guys when they go out on a call like that. So they'll just simply talk to the business owner or the manager who's there and explain to them why they're there and observe for themselves the practices that are being taken there.
And what have they observed so far? How's that been going?
It's been going very well. So far, they've observed best practices in all of the businesses that they've had to go out to. So it's been working well.
Oh, that's good. That's really encouraging. Thank you. Let's see, checking in here. So what advice do you have for potential customers as they go out and visit local businesses? What should they be keeping an eye open for?
Yeah, keep an eye on any crowding that's taking place. If there are lots of crowds in a waiting area, which should not be happening at this time, you might want to consider going somewhere else. You can even follow up with our hotline if that's the case. We can always send somebody from RCPD there. Also look for the employees to be wearing masks. Any employee who's handling food does need to have a mask on. So it may not be the hostess, but they do need to make sure that they have proper shielding or that they are 6 feet from the patrons, and just making sure that cleanliness is a big thing. Making sure that the place is sanitized, that they're using disposable menus. That is a requirement of all restaurants, that they do use disposable menus. That way they don't have to clean every single in between usage of the menus. Those are some of the things that you can look for.
Okay, thank you so much. And I know this idea is kind of in the works, and it was discussed in that recovery task force meeting too. Maybe a way like a checklist for businesses to kind of display the steps that they're taking to keep employees and customers safe. That's kind of in the works. We might be releasing kind of that template with next week with phase 2, after we've had a chance to let the task force weigh in on that as well. So just kind of ways for consumers to be empowered and make educated choices about what businesses or establishments to visit, and maybe when to kind of turn around and perhaps take your business elsewhere. But again, we've had great reports of compliance, even when RCBD has kind of been sent out on a call to check. They've seen good results and seen businesses in compliance, so that's a great thing. I know one concern was folks maybe waiting outside of a business. Can you talk about those situations at all? Kind of crowding that might occur. Yeah.
Sure. We really want to limit crowding anywhere, but certainly inside the building. So we would advise people to wait in their cars if they can, if that's something that they can do, to avoid having to stand out on the sidewalk. That's something that we would highly suggest. Again, we want to avoid any crowding. And it would just be a lot easier just to be able to wait in your car. Or again, if it's that busy, maybe taking your business somewhere else.
Okay, well, thank you so much. Do any members of the media have any additional questions? I've seen a couple things come in on Facebook, but they scroll by so quickly. I mostly just see watching notices right now. So if I've missed your question, I apologize.
Vivian, this is Bailey Britton with the Collegian. My question is, Are there any current hospitalizations in Riley County?
We do currently have one Riley County resident in the hospital, Vivian, correct me if I'm wrong, and another PUI, two. I knew I'd get two Riley County residents in the hospital and one patient, a person under investigation was what PUI stands for. That person is from Pottawatomie County.
All right, thank you.
A question came in about when salons and kind of personal care establishments might be able to reopen.
It will likely be on May 18th. Again, that will all depend on our situation, but according to the governor's phases, she does have places like that, those businesses opening in phase 2, which will take place no sooner than May 18th.
Okay. Well, I think that's all we have for today. We will not plan to do a broadcast this weekend unless there's a breaking news or development we need to tell you about. We'll be back next week, Monday, Wednesday, and Friday at 4:15. If you have any questions in the meantime, feel free to email them to the Q&A hotline. And that email address again is Riley County COVID-19. That's Riley County COVID-19@gmail.com. We hope you all have a wonderful weekend and we will see you next week.